All right, welcome everyone back to another episode. Today I'm with Dr. Jon Perenack. He's a cosmetic surgeon practicing in Louisiana. John, thanks for joining us on the podcast.
Well, thanks, Frank. Great. Thanks for having me on.
Yeah, can you just give us kind of a brief history of your training and your current practice setup?
Yeah, sure. I'm just shy of 58 years old, so I've been out for a while. It's always kind of fun to think about training because I finished in 2003, so we're talking 23 years ago. But having said that, I mean, I guess things start at the beginning, and training is certainly where things began. I'm a Canadian. I did my undergraduate work in Bachelor of Science at the University of Alberta. Did my dental school training at Loma Linda University in California. I was actually 2 years right behind Alan Herford. Alan's a pretty impressive guy, and he was actually kind of fun to work with. And then from there, I went and started my training, and I did a 6-year MD combined program at LSU down in New Orleans. With Jack Kent, the great Jack Kent. We had Mike Block there at the same time and a bunch of other guys. And I did my 6-year program there. It finished up in 2002. And I remember in 2001, I was finishing up my 5th year. And as you normally do, you make your residents present on something. And so I chose rhinoplasty to present. And I did a rhinoplasty presentation, and Jack Kent came up to me and he said, John, I think you'd be good at academics. Now, probably they just needed some bodies there to staff anyways. But he said, I think you'd be good at academics, and I like your presentation. What do you want to do? And I said, I really want to do facial cosmetic surgery. And I said, I'd love to do a fellowship. He goes, well, yeah, well, why don't you do that? And I said, well, because I'm poor. I'm a Canadian. I think I just got my green card. I'm in town legally, so there's that. And I said, I'm kind of poor. Hard to find the ability to do a fellowship. He said, well, what if we found a way to help you with your fellowship, and then you could come back on staff at LSU? And Jack Kent was able to make things happen, and actually they were able to help fund me through a fellowship. So I did a fellowship in Abilene, Texas, with Howard Tobin, who's an ENT-based cosmetic surgeon. He actually was one of the founding members of the American Board of Facial Plastic Surgery. And then later on, he went out and started doing body cosmetic surgery. And so he split off from the facial plastics group at that point. And I think when that had happened, it kind of separated him from the ENT guys who was doing facial plastics. So he took a lot of oral max. So if you think about people who are ahead of me in that fellowship, Angelo Cusolina, Jacob Hayabi were two guys. Jacob was 2 years ahead of me, and Angelo, I think, was 5 years ahead of me at Howard's fellowship. And it got out. And although I was trained in full body, I've always stuck to face. I went back on staff at LSU in July of 2003. And was junior faculty for a couple of years. It was great. And then in 2005, I had the opportunity to become program director for LSU. And I was program director, which was kind of odd because that happened right in June of 2005. And lo and behold, in August of 2005, we had a storm in Louisiana. We had Hurricane Katrina come through, and it put New Orleans underwater. And so as a young program director, and along with Jack Kent, who was still chairman, I think, at the time, we had to move our 40 residents all over the place and reestablish where they're going to be. But that's the training that I started. And I can go on from the story from there if you like, Grant, and kind of catch you up to where I am now. But
That'd be great.
that was the training. And so fellowship trained with Howard Tobin. I did a full body fellowship, but I've stuck pretty much strictly to face because I've always loved doing facial work. It's nice to have the body background. Because patients come in, they'll ask me, well, what about this or what about whatever? And I refer them to, I have a plastic surgeon in my office now who does our body surgery for us, and I do all the face. And it's a nice arrangement, and it's nice to know what goes on. But, it was interesting because, how do you wind up where you wind up? We've had a fellowship in my office now for about, we're in our 9th year now. And some fellows have gone into academics, but most of them go into private practice. And they're like, well, I go into academics, how do I know this is going to work out well? And the truth is, and this was true with LSU, you need to have a chairman and usually a chancellor, or if you have a dental school there, the dean who's supportive of doing facial cosmetic surgery, because in a lot of places they aren't, and they want to just do dental implants all on fours, and that's great. There's nothing wrong with that at all. But you need a chairman who wants to have cosmetic surgery happen. And unfortunately, I had that with LSU. And so Jack Kent, once we had our big event was Katrina. We were out of New Orleans for about almost 8 months while it got cleaned up. And even when we started moving back into New Orleans, we really didn't have a site for a long time to practice or to have faculty practice. And that kind of led into where I am now. I have an office in Baton Rouge. And the problem LSU had was the way they paid their faculty is that they had you got a base salary, but most of it came from your faculty practice. You got reimbursed for faculty practice, and it was almost a keep what you kill sort of thing. Well, all of a sudden, no one could kill anything, and no one could keep it, so they couldn't. LSU couldn't keep their faculty. They lost their entire periodontics department, and so they were desperate to try and keep people on. And they said, "Well, go find something in a private arena, and we'll sign affiliation agreements, and we'll make things happen so you can stay on." And that's actually what happened. One of the oral surgeons in town in Baton Rouge, because that's where I wound up, said, "Well, I know a guy, and they had a facial cosmetic surgeon, but he moved on, and there's a slot there. Why don't you come and work there?" And he was doing cosmetic surgery in this eye center one day a week, actually one day every other week. And I said, "Okay, let's try that." I met with some people who owned the eye center, and they said, "Yeah, sure, come on in." And LSU signed an affiliation agreement. And so for about 6 months, I would go over there. This is like in 2006 by now. I'd go one day a week, every other week, and we'd do facial cosmetic surgery, see patients, see consults, see post-ops, that sort of thing. And it kind of caught on and it got bigger and bigger. And so eventually, within a year, I was doing one day every week, and then it was a day and a half every other week, and then it got to 2 days. And meanwhile, during the same time, LSU was slowly creeping back into New Orleans, and we were getting a medical center set up. The actual medical center that they're in now probably took about close to 9 years, I want to say, before it was finished. But
Wow.
because I actually did the first oral surgery case there in, I think, 2015. So we're talking almost 10 years for the center to actually be set up. But in the meantime, they had some things there. So I was building up a private practice in Baton Rouge while still full-time faculty with LSU and staffing the residents, still doing facial trauma, still doing some traditional oral max during that time. And during that time, Jack Kent, I think he retired 2 or 3 times, and we had different people come in, and they were chairmen that we had. Lickus Reddy was there as chairman for about 3 years, and then we had Dan Spagnoli, then we had John Neary for a little bit. And probably around 2016, I love being in academics, but I just had gone through too many chairmans, and I did not want to become chairman. I like teaching, and I like being with the residents, and a chairman job is a tough job. So I decided to go full-time into private practice. And so I actually moved my family up to Baton Rouge. By that time, I was 4 days a week up there, and we were busy. And I've been there ever since. And right around, I guess, like I said, we're in our 9th year of offering a fellowship. We started offering the fellowship in 2017. It's a 1-year fellowship. It's accredited through the AACS, or the American Academy of Cosmetic Surgery. And it's been a lot of fun to do it. It's always good to teach. It just is. So
Yeah,
that's a lot, but that's kind of how it happened, honestly.
very cool. And so you're spending most of your time with facial cosmetic surgery these days.
Yeah, it's nothing but facial cosmetic surgery. I don't have a cone beam CT scanner in my office. We don't do teeth. I don't do dental implants. It's not that I don't like those things. It's just that that's what the practice has grown out to be, and that's how it's set up. So in a lot of ways, it's very much like a facial plastic surgery practice. I've got 3 offices. We've got a big office with a fully accredited Quad ASF surgery center in Baton Rouge with 3 OR bays and recovery area and all that. A large 9-room clinic area, conference area, and that sort of thing. And then we have 2 other little offices where one in Lake Charles, it's about 4,500 square feet, and then another office in Gonzales, which is about half an hour away from the Baton Rouge office. It's also about 4,500 square feet. I don't go to those offices, but we have nurse practitioners and physician assistants who do injectables such as Botox or Juvederm or Restylane, and then we have estheticians at those, and they kind of feed patients for surgery back into the main office. And it's kind of fun to have the other offices to just develop that. Had a body plastic surgeon in our main office doing body surgery now, oh gosh, for about 15 years, although we're on our third one. One thing or another seems to happen, but we've had our current surgeon, Dr. Picarella, is great, and he does our body surgery for us.
Oh, very nice. What advice would you have for oral maxillofacial surgeons who are either residents or young surgeons getting a practice started who want to have some component of facial cosmetic surgery in their practice.
Yeah, and I think that's probably the right way to look at it. It's very rare that you see someone who's just straight facial cosmetic surgery. I mean, I think Joe Niamtu does it. I do it. There's probably a few other ones in the United States, but most are kind of more like a Sammy Nizam or a Daria Hamra, who they do 2-3 days a week of oral max, and they love doing that. And then they have maybe 2 days or 1.5 days a week of facial cosmetic surgery. I know Mike Will, who's like one of the past presidents of AACS. He did all his training, and he was spent a lot of time in the Air Force. And when he got out, he does full body surgery, and he'll have patients in his waiting area who are having a breast augmentation and someone who's in there for an infected third molar. I mean, it's really interesting, but
Yeah.
most people wind up having a mix of both. It's obviously you need to get some aspect of training, and so if you're a resident and you're a third-year resident or a second-year resident, you're thinking, well, gosh, I want to do this. How do I do it? The first thing is training. If you have that aspect of training in your program, well, that's great. And if you feel like you get enough, and you certainly want to have enough training so that you can get OMSNIC or MedPro or some insurance company to insure you for it, and then you want to get hospital privileges to do it, even if you're going to plan on doing it in your own office, then you can go ahead and start thinking about how will I integrate this into my practice, or if I'm going in as an associate, how will I integrate this into my associateship? If you feel like, well, I don't get enough experience to get malpractice insurance, or I won't get enough experience to get hospital privileges somewhere, you have to figure, well, how will I get that experience? And the fellowship route is probably the best way to do it. And then you're really looking at either going through the AACS. There are two CODA accredited fellowships in the country. One is by a good friend of mine, Manoli Malakakis. The other one's a good friend, John Griffiths. Manoli's up in New Jersey, and John's over in Mississippi. And they're good fellowships, like the ACS fellowships. Both groups will take single degree or they'll take dual degree applicants. And I've had both, and they're both great. I don't really care if you're DDS only or DMD or DDS MD. I think your surgical technique is the more important thing. And so you do that, and then you'll get out and you have to figure out, well, what do I want my practice to look like? Most people, if you're going into an associateship, you really need to talk to your senior partner or partners about, are they going to support the idea of having a cosmetic surgeon in their practice? Just the mechanics of being an oral surgeon is that you have to become a good businessman. And of course, they don't teach that in residency. And so if you're an associate, your senior partner, they want to develop you, and they want to make you feel good and happy and all these things, but also they want to make money, and they don't want their practice to lose money. So you need to talk about that up front if you're joining. And there's no reason why cosmetic surgery can't be very lucrative and pay the bills and also be really rewarding, because what we do is inherently rewarding. It's fun. But talk about that ahead of time. There are some things that we need as a cosmetic surgeon that most oral max surgeons don't have any use for. Such as when I'm doing a deep plane facelift and I'm taking out some mandibular glands, I need a ligature or some kind of a device to remove glands safely. And it's not terribly expensive. It's $15,000, but for your traditional oral max senior partner, he doesn't see a need for that. But maybe have it written into your contract that you have something that can expenditure for that sort of thing. Or maybe it's a tightening device. Are you going to have estheticians? If you want to have estheticians are great to have. They help make your patients look really good after surgery, before surgery. They do help. You have a constant flow of patients through for cosmetics, but a lot of things that they do require devices, and medical devices are typically expensive, running from in the low $30,000 to $50,000 for a skin tightening device, up to like maybe a Moxie laser. Now you're dropping $150,000. So what will happen with your practice to do these things if you're working as an associate? Now, if you're going to be just out on your own, and I see no problem with that, having been a program director for 10 years and seen over 40 different residents graduate, the ones who went on their own, they're usually pretty happy. I mean, they may be a little lean for a few years, but they make their own decisions. They call their own shots. They all seem to do pretty well. And so then if you're calling the shots and you own the practice, you have to decide, where do you want to put your resources? What do you need to have? I mean, I love having a CO2 laser in my office. I use that thing all the time. It makes my facelifts better. And so if I had to buy one device as a surgeon, that's probably the first device I'd buy. And then if I was going to have an esthetician, we'd look at maybe something to treat reds and brown pigmentation, maybe laser hair removal, that sort of thing. So it's complex, just like going into business is complex. But as always, it starts with training. Make sure you know how to do the procedure, how to manage the complications, how to manage the patient, and then figure out, well, how will this work? Am I on my own, or am I going to be an associate? If you're an associate, you have to figure out, how do I relate to my partners? If you're on your own, yeah, figure out what works best for you.
Yeah, all the cosmetic surgeons I've known, for some reason, they're all very passionate and happy and really enjoy the work they do.
Yeah.
Not to say that's not the same for oral and maxillofacial surgeons extracting teeth and doing implants, but there is a
Well,
different
it's
feel.
different, isn't it? I mean, when people come to see you for a third molar extraction, no one's looking forward to having their third molars extracted.
True.
It's like when your fridge goes out. You know, when your fridge breaks down and you have to buy a new fridge. No one's happy buying a new fridge. You know, I had a
Yeah.
fridge. Now I have to buy another fridge, and it's going to be painful to change my fridge out. That's kind of like third molars.
Yep.
You know, generally speaking, people come to see us because, you know, they'll come in and they'll say, well, Dr. Perenack, what do I need? And the first thing I say, you don't need anything. You are good just the way you are. I said, I am like red bottom shoes. And most of my patients get that. Either they're
Yeah.
women and they have red bottom shoes, or they're men and they have women who have red bottom shoes. And they're like, yeah, okay. And so what would you like me to help you with? How can we get you there? So most people are pretty happy. Recovery is actually fairly easy for most things I do. Interestingly, you'd think there'd be more pain. You know, I just had a facelift we did yesterday. It was a deep plane facelift. We went all the way under here, lifted everything up. We removed glands, tightened the deeper tissues, shaved digastrics, all that kind of stuff. And she had a loose neck all the way down here, and now she's nice, high and tight. It looks great. And her biggest complaint was she has some blurry vision right now, just because we had eye shields in and we did her upper and lower blephs at the same time. But the facelift really doesn't hurt, just kind of tight. So
Mhm.
most patients, pain's not a big issue. I can usually get people back to work in about 7 to 10 days. So yeah, it's a happy office for the most part.
Yeah, I could see that where the patient comes in, it's more of a exciting thing for them to think what's possible. You know, they can see the problem, and then once the surgery is done and healed, they can see the solution.
Mhm.
Whereas wisdom teeth is like, yeah, someone's told me I got wisdom teeth that are causing trouble and they're gonna come out, but I don't really, half the time the patient doesn't even know there's a problem, and it's a
Yeah.
whole different feel.
And you know, inherently, most people are pretty visual. So, having done this for a long time, I have a lot of before and after photos. So we can go through before and afters. I can find a number of people who look like the patient who's sitting in my chair, and I like doing before and afters as opposed to just imaging the person on software. Say, well, look at this. Here's where they started. Here's where they wound up. Would you be happy with that? And most patients are like, oh yeah, that'd be great. I say, well, notice this. We have still some lines and wrinkles. If we wanted to treat that, I'd do laser resurfacing. Maybe we treat under the eyes, and you really can kind of customize your treatment plan for them. Yeah, so it's a happy practice to be in, and it makes people pretty. It's nice because, you know, they get older. Everyone loves their mother, but no one wants to actually look like their mother or their grandfather. And the key
Exactly.
is to get them from point A to point B and have them still feel like themselves, but just look better and younger. That's a good thing.
Yeah. Are there any, I guess you could say, surgical principles that you've learned through facial cosmetic surgery that you feel could potentially benefit the routine oral maxillofacial surgeon? Or, I mean, is there anything there that you've felt like, gosh, this really is a useful thing, and I wish more oral surgeons did this?
Well, I mean, for things inside the mouth, I would just tell you that when I was doing things inside the mouth and doing cosmetic surgery, back when I was in, you know, a residency director, because you had to do a little bit of both. Be picky. Just be really picky. I think if you're taking out thirds, sometimes the emphasis gets to be on, well, how fast can I take these thirds out? And that was fun. And there's something enjoyable about cracking out an impacted third and getting it out of the way. But then, you know, how do you manage your tissue? When I'm doing work on the outside of the face, I assume that all my patients have one of those funhouse mirrors at home, you know, those 10-time power mirrors, and they can lean in and they can see every pore on their face. So I always use loop magnification. I don't think you need loop magnification to take out third molars, but if you're in the anterior aesthetic zone and you're doing dental implants, I can't imagine why you wouldn't want to be able to see that area better than your own patients. So I think in select areas where you're doing aesthetics, you know, in the mouth, yeah, maybe get some some loops. I like a 3.5-time power extended field. Like I said, I'm almost 58. My vision is not as good as it probably was, I think, when I was in my 30s. It's nice to be able to see everything really well. I have a big, you know, really good headlight, so I can see everything exceptionally well. And I think maybe that would be something that your audience could take into account when they start thinking about anterior aesthetic zone, implants, restorations, that sort of thing.
Yeah, that's a good point. I've noticed that too. I mean, I've only been out for 15 years or so, but just how powerful loops can be, make you a lot more aware of some of the nuances going on there during the surgery.
I'm always amazed at how a lot of faculty members are very anti-loop, and even my head and neck guys are, unless they're doing microvascular and they have the big microscope come in, all of them say, "Oh, I don't need loops. Loops will make you better. They're not going to make you worse." Certainly now that we have the extended field loops, so you can really see the whole picture, and you're not going to get stuck into one tiny little area. I think loops are just so helpful. That and a
Sure.
good headlight. Yeah, a good headlight.
Oh, yes. I can't do anything without a good headlight. That's like, just makes me so cranky for when my headlight's not working or I can't, I have to use an overhead light. But no, super, super important things. As a side note, our last Amos meeting, there was a lecture on how loops potentially, there's been some research showing that they can contribute to more neck and sometimes back problems. I mean, have you experienced that with loops of like holding your head in a certain way and now your neck hurts?
The short answer is no. I'll tell you though, I have a Brahmaba chair in my office, that I operate on, and I don't know if you've seen one of those chairs. I mean, those fancy German chairs, they have a foot pedal, so you can make the chair go up, down. It can airplane. You can adjust it. And so one of the, when I have a new fellow, invariably when they're operating, you'll look at them and they're adjusting their body to where the patient is. And I tell them, no, don't do that. Adjust the patient to where you should be. That's so true. I mean, we're not bricklayers, but man, we do physical labor every darn day, and you have to kind of figure out where you have to have your head and your neck and your arms, to be comfortable. And so having a good chair that you can adjust up or down very easily, I think, is handy. For me, the answer was the Brahmaba chair, and actually it was Michael Block who turned me on to that, because he bought one, and I know Mike, and Mike's cheap. He doesn't spend money unless he has to. And I appreciate that about him. I mean, he's fiscally sound. We'll call it that. He's fiscally sound. And he spent like this $30,000 on a Brahmaba chair. I'm like, dude, why did you spend that money on a chair? Then I got one, and I tried one out at one of the Amos meetings. I was like, man, this thing is great. And if you're doing it under general, or if you have a nurse anesthetist in your office who's, running your anesthesia for you, or if you even do it yourself, it's so handy because it has a foot pedal, and it has a really easy foot pedal to use. So I can make the chair go up, down, adjust. And so I never have to turn my head too much. And if I find myself turning my head, I make myself get back in the right position. I just adjust that chair up to wherever I need to. If I have to airplane it, I do that. So yeah, I think that's so important. You're right. You look at, like, why do some people have to quit early? Well, it's because they wind up having some kind of disability, neck, cervical pain, or you have issues with carpal tunnel. The more you can do to get yourself into a good neutral body position to operate, and I don't care what kind of surgery you're doing, you're just better off for it.
100%. Any counsel for a young resident who's, interested, wanting to get into more cosmetic surgery? I assume you'd say, got to shadow people, try to do fellowship, things like that. Any other tips for that type of a surgeon?
Yeah, I mean, where are they going to go get experience if they don't have it in their program? You can go to the Amos meetings. Amos just doesn't do a lot with cosmetics. I mean, and I say that being on the clinical interest group for cosmetics with Amos, and we do some things, but it's not a lot. Make sure if you go to the Amos national meeting, go to the SIG, go to those sort of things. But your big resource will probably still be the AACS, the American Academy of Cosmetic Surgery. They have a big meeting every January. It's a pretty good meeting, and you'll have oculoplasts there. You'll have some ENT guys. The ENT guys there are invariably also doing body surgery. That's why they're there instead of at the facial plastics group. And probably over 50% of the membership of AACS is oral and maxillofacial surgery. There's a lot of derms there as well. So go to the AACS website, check into their meeting that they have in January, February. Go to that meeting. A lot of times there'll be other little meetings that happen throughout the year. I was part of a cosmetic cadaver meeting in Florida about 2 months ago, and we had a cadaver course, and we had, and probably about a third of those attendees were residents who came, and they got cadaver experience on cosmetic procedures. And so even if you're not doing it in your residency, you can get experience or get exposed to these different things that are going on. And then if you really find that you like it, that's when you start looking into and exploring a fellowship. The AACS fellowships they match basically a year and a half in advance. So we just accepted our guy for July 1st, 2027, about 2 months ago. So keep that in mind if you're looking at the fellowships, and for if you're looking at just doing a facial fellowship, I think there's about 6 or 7 facial fellowships that are out there, and learn as much as you can, read as much as you can. The other thing that's such a huge resource now, if doesn't involve going to meetings, is like what we're doing right now. There's so much social media, and there's just great guys who you can follow their material. Mike Nyack, Ben Talay, Jacono, myself, people who are in Oral Max like Sami Nizam or Fazil Qureshi, and just see what they're doing online. And then once you start following them, look and see who they're following, and you can kind of get this overall social media training, so you can at least see what's topical, what's going on. Why is the deep plane facelift such a big deal now, even though Sam Hammer talked about it back in 1995? What's changed? So those are all good resources if you're in residency and you're thinking of doing this. If you're poor, like I was poor in residency, social media is very cheap, and it's much easier than going to meetings. Trying to get your program director to give you 3-4 days off when you're in medical school, or if you're on general surgery rotation. Maybe you can't get to the meeting, maybe you can't afford the meeting, but you can afford social media, and you can learn an awful lot there.
For sure. Yeah, this has been really helpful. If we have listeners that have further questions, would you be okay if I put your contact information in the show notes?
Sure, absolutely. Yeah. Yes. Send me something at my usually my Hotmail. Yes, I have a Hotmail. That's how old I am. Send it to my Hotmail. If I don't get back to you right away, I'll send it over to my current fellow, and he can get back to you and give you some information too from time to time. If you want to come and visit our office, we have people come in and visit our office for a day or so, and I usually get them in touch with my head nurse who does our accreditation, and she can kind of say, oh, this Thursday or this Friday is great. We've got a facelift on. Why don't you come on in? And you're certainly welcome to hang out.
We end every episode with some rapid fire questions.
Okay.
First question: what's the best book you've read in the past year?
Oh, geez. Well, what's the one my son and I were reading it? I'm stuck on the title. Let's come back to that one.
Okay. Next question: what things do you do outside of the office that can kind of help you with your daily cosmetic surgery skills? Is there anything that you do that kind of keeps you fresh and keeps you going?
Well, I mean, obviously work out. I lift weights and, keep fit. I go to the gym about 4 or 5 times a week. That's good. I paint. I've always done oil painting. I've got 3 big canvases set up right now downstairs in my house where I'm working on those. Each one's about 6 feet by 3 feet. Is a series right now I'm working on. And, and most of the time it's not representational art. It's more of an abstract, but sometimes I'll have a little bit of both in it, but yeah, painting's good.
Yeah, I noticed that too on your website. There's some really cool paintings, and kind of talks a little bit about that aspect of your life. Is that just kind of therapeutic or relaxing for you? Why do you paint?
I don't know. I mean, I've always done it. I remember I was doing oil painting back when I was like 12 or 13. And, I was kind of a geeky kid. I played Dungeons and Dragons, and I was a dungeon master. And so I was always good at drawing and artistic skills. And so if you're, having people do something in Dungeons and Dragons back then, we didn't have, the computers were kind of crappy. It wasn't like Elden Ring or something like that. And so I would draw the picture. Okay, you've come through a door and this is what you see. And then I would make other ones that were color, and then do more oil painting. Sold oil paintings. It just kind of was a fun thing to do. And then when I got into university, I took a number of courses where I had some people who really promoted using large canvas. I love large canvas, so I don't like doing little tiny pieces this small. Most of the work I do is 3-4 feet minimum and up to 6-8 feet in size. It's just fun. And the thing that's nice about oil paint is you can put a layer on and you can leave it be. If you can't get to it for 3 weeks, it's still there when you get back. It might still be drying. And so you can do things to it. And so there's not the rush that there is with so many other things in our life. And so you can work on it, spend some time, and then come back. And I always say to patients, I'll fiddle with surgery a little bit, where I'll come back to a painting and it's been 5 years since I've touched it, and I'll look at it and be like, you know what? I need to put some purple right there. or something, and you kind of adjust it. So it's just fun. It really is. It's nice to create stuff. It's like I like teaching. I like artwork. I mean, they kind of go together a little bit. You're telling a story.
Yeah, creating is a powerful process. It's so fun. Next question. Usually I ask what forceps you use to extract tooth number three, but you probably
Yeah, I
don't even
don't.
remember forcep name. Is there a favorite or, suture material you use or instrument that
Oh,
you
gee,
use
man, we're reaching
regularly?
on that one, aren't we? My favorite thing that I've picked up in the past, man, in the past year, since really doing a lot more deep work under here, if you are doing facelifts and you have not bought yourself a ligature to take out glands, you need to buy that device. That will change your life. I watched Joni Amtu's videos of taking out glands with a Bovie, and it scares me every time. When we used to do it, you get seals. If you hit the facial artery, it was a big mess. You do that ligature, it is clean, it's bloodless, it seals the gland, you don't get seals. It's just such a great device. It's
Wow.
designed to take out thyroid glands, which are inherently bloody things, and it will
Okay.
seal a vessel that's 7 millimeters in diameter. It's kind of weird being excited about something that seals a 7 millimeter diameter vessel, but man, I'm excited about that device. It's a great device.
Oh, that is cool.
Yeah.
We could probably put a link to that. Is there like a name for that or a brand name?
Yeah, so it's called Ligasure, Ligasure, Ligasure. And
Okay.
so you have to, yeah, there's that. If you're just buying a Bovie, uh, basically it's a box by Ligasure, and then the handpiece goes into it. It's like a little clampy device. But if you're buying a Bovie, if you're fresh out to practice, just buy their box, and you can buy their Bovie that hooks into it as well. So
Okay.
rather than just buying a standard Bovie, get one that has the Ligasure device attached to it as well. And you buy the disposable handpiece for cauterizing vessels, or if you're just doing traditional, you need something as a cautery, you can hook the cautery into it and use that.
Got it. Awesome.
Fantastic device, really is. Worse than $50,000. And like I said, if you haven't put a Bovie in your office and you need to, that's the one to get, because you can always add the Ligasure handpiece onto it.
Awesome. Next question is, what's the best TV series or movie you've seen in the past year?
Yeah, my wife loves watching series. Probably Your Friends and Neighbors was on, I think it's on Netflix, with John Hamm. John Hamm is like this hedge fund guy, and then he gets sort of framed for murder, and then he loses his wife, he loses his job as a hedge fund, and he turns to robbing the houses of his neighbors who he knows well, because they just have all this expensive shit and they don't know that they have it. And so he'll break into their house when he knows they're on vacation and steal like their Patek watch and sell it for money. And it's on the end of season two. It's a great show. It really is. John Hamm's a fun actor to watch. It's interesting social commentary, but it's just a great show. It's well written.
Well, that's fantastic. Do you have a favorite quote or something like a mantra?
Well, um, you do a lot of rhinoplasty, and if you do facial plastics, rhinoplasty is kind of it's kind of the thing that distinguishes yourself. Now it's deep plane facelift for most people, but rhinoplasty historically been facial plastics where you really make your thing. Residents, when you're teaching them how to do it and you're talking about getting down onto the septum, there's this thing where you try and make sure you're subperichondral. And a lot of times when residents are first starting to do that, they wind up being super perichondral, and then there's bleeding ensues and it's a mess. And so they're like, well, how do you know when you're subperichondral? And my quote to them would be, being subperichondral, this is a nerd quote if ever there was one. Being subperichondral is like being in love. If you have to ask yourself if you're subperichondral, you ain't subperichondral. It's just like being in love, man. Just like being in love.
Oh, that's great. That's definitely, we haven't heard that quote before, so that's a new
Probably
one.
not. That's a very specific quote for a specific situation.
So great. Last question, do you have kids and do you have any parenting tips?
Yeah, I've got three. We've got two who are quite a bit older. We have one who's 34. I've got two grandkids, a
Oh,
three-year-old granddaughter and a 6-week-old granddaughter, and they're great. She's a respiratory therapist. Her husband's a contractor. And I have the middle son who's 32. He's a lawyer. He's still a good kid anyways. He's not married. I don't think he plans on getting married anytime soon. He's figured out a way to do all of his practice online. So sometimes he's at my house. Sometimes he's at one of our other houses. Sometimes one time we turned on the TV and he was behind the bench at a Knicks game. So he could be anywhere. I don't know where he is right now. And then I've got a 17-year-old who's just becoming a senior at the Episcopal High School here in town. All three of them are very different. All good kids. Sometimes we've said they are the worst good kids out there. But they're good kids. You try and be supportive. I think so. There's obviously an age gap between the first two and the last one who kind of came along suddenly. One perspective I have on the younger one is that this time I have with them is it's short. It's really short. And so we have most of my fellows come to our fellowship with like one or two or three kids. A lot of them have kids while they're here at the fellowship. And I tell them, spend time with the kids as much as you can. My son still likes to, maybe 2-3 times during the week. We have a hot tub out at the house. We have these big live oak trees. It's all lit up in the backyard at nighttime. We'll go hang out in the hot tub and just talk about random stuff. I love that. And it's nice to spend time with him because I know he's got one more year in high school, and then there's a good chance he's going to go off to college. And, we won't see each other as much. Although if the middle son's any indication, he's going to be still at my house from time to time, even when he's in his 30s. So you never know. But enjoy your time with your kids. Because
Sure.
that goes by fast.
I agree. I just had I have 6 kids, and my oldest just moved out into college. But yeah, to me as the father, it seems like, it just went by so quick. I can remember her being born like yesterday. And yeah, same thing. I feel like being present, doing enjoyable things. In this day and age, it's the phone and everything else that's competing for attention. So it's trying to get rid of all that and just saying, I'm here for you, and we're focusing and having a good time together.
Yeah, I think one thing that as a parent, you offer your kids. I mean, I don't think you're your kid's friend, but you want to be there to be a sounding board. But you can offer perspective that most of the time they don't have, especially when they're in their teen years and everything seems like it's a disaster, or something happens and it's horrible. And you can say, well, yeah, that is horrible, and I hear what you're saying, but think about this context. How's this going to look in 6 weeks? How's it going to look in 6 months? How's it going to look in 6 years? So you add context and perspective to it, and just be there to help your kids, but also enjoy them too.
For sure. Love it. Well, John, thanks so much for taking the time to talk with us. This has been awesome. I can tell you're a great surgeon, great person, and I really appreciate you sharing your wisdom with us.
Hey, thanks for having me on. And like we talked about, if any of your listeners want to contact us, if they want to come visit, they certainly can. If they're interested in a fellowship, come and spend a day or so with us, get a chance to know what our fellowship's like and what we do. Fellowship's different than a residency. When you're a resident, and maybe there's 6 or 8, or in LSU's case there's like 30 of them running around. If you have a staff who you don't like, you can kind of hide from that staff. The staff doesn't like you, he can kind of hide from you. Fellowship, there's no hiding. You're kind of stuck. You're going to see me. You're going to see my staff. We do work also with LSU, so they do get some time down there. Make sure you enjoy the place, because you want to have an enjoyable year. And we've had 9 really good fellows, so it's a good time for everybody.
Well, thanks for offering that. That's invaluable. All right, well, good talking to you. I hope you have a good rest of your day.
You too. All right, thanks, Grant.
Bye.
Thank you so much for listening to this episode of Everyday Oral Surgery. For more information on these podcasts, please visit everydayoralsurgery.com. I love feedback and would be very grateful if you would reach out to me via my email, grantstucki@gmail.com, and let me know what you thought of this episode. Or you can text me at 720-441-6059. Additionally, if you have any topics you'd like to hear about, or if you would like to be a guest on the podcast, please email or text me. I found many of my interviewees through people who have been contacting me and have been listening, and I've gotten so many great ideas for more podcasts, and that's what helps keep the podcast rolling. So I really appreciate you making that extra effort and helping me out with feedback and knowing what to do next on the podcast. Thank you so much.